Thank you for your time today. My name is Sarah McKinley. I'm a physician consultant with DynaMedex. I'd like to go over some reasons why DynaMedex is the best clinical decision support tool on the market today. The most important job that a clinical decision support tool has is to provide vital information to clinicians at the point of care quickly, reliably, and easily. Clinicians are facing multiple clinical demands, complex decision-making, and administrative challenges. They need timely, accessible information that fits into their workflow when and where they need it. In the face of those critical demands, DynaMedex provides clinicians with the tools they need. DynaMedex tools are efficient to access and to use. They represent the most current scientific evidence available. DynaMedex tools provide that evidence after rigorous literature search and critical appraisal to ensure the information provided in DynaMedex is complete and accurate. DynaMedex tools provide that quality of evidence in the context of clinical topics. Given the power of the DynaMedex set of tools, DynaMedex represents a huge value to clinicians and aids them in communication with other multidisciplinary team members and ultimately with their patients. DynaMedex is designed with the busy frontline clinician at the point of care in mind. Topics include an overview and recommendations section at the top of each topic. This section highlights key points needed for the understanding, evaluation, and management of clinical conditions where they can quickly and easily be accessed by the busy physician. The bullet-pointed format makes finding needed information fast when compared to the textbook style of other reference tools. Many common topics include diagnostic and treatment algorithms to help clinicians identify the next step in evaluation and management rapidly. Topic pages also include several other tools that make finding key information effortless, including the left-sided index and multiple hyperlinks within each topic. DynaMedex is also accessible via mobile device. The app version of DynaMedex has the same powerful tools as the desktop version. Utilizing the voice search capability of the app, either in the main search bar or via the Ask Watson for Drug Information app. Here, I'm using Ask Watson to check for drug interactions between two medications my patient is taking. I use the voice search to say two medications, azithromycin and melatonin, into the Watson Assistant. Watson correctly guesses based only on those two drug names that I'm asking about drug interactions. I type in yes to confirm to Watson that I am looking for drug interactions for the selected drugs. And Watson returns not only information about drug-drug interactions between those two medications, but a host of other information, including drug-ethanol interactions, pregnancy and lactation information, among others. I can similarly use the voice search in the main search bar to find medical information, making this a very quick and efficient tool for clinicians at the bedside to find needed information. The COVID pandemic and our rapidly evolving understanding of how to prevent and treat the manifestations of COVID reinforce just how vital it is for clinicians to have the most current information available at the bedside. DynaMedex partners with McMaster University, whose machine learning approach to literature surveillance has been shown to be highly effective and efficient in peer-reviewed publications. Building on that systematic literature surveillance system in partnership with McMaster University, each day over 500 journal articles, guidelines, and Cochrane reviews are monitored and screened for relevance and quality. These studies are sent to DynaMedex's in-house subject matter expert clinicians and statisticians for further review. As a result, over 32,000 scholarly works are screened annually. If those works pass muster, They are graded and synthesized and incorporated into the DynaMedex tool. Over 8,000 are incorporated in our tool annually. We don't delay publication. We immediately upload them into our database, often within 2 weeks of original publication. And we'll let you know about it via topics you choose to follow within DynaMedex or on our recent alerts on the DynaMedex homepage. An independent review of currency published in the BMJ reported that 87% of key clinical reviews identified by the study authors were cited in DynaMedex at 9 months, compared with all other clinical decision support tools who cited less than 50% of them. Based on this rigorous literature review process and supported by independent confirmation of the quality of its results, clinicians can be confident that information in DynaMedex is current and rigorously appraised. Relevant clinical evidence produced by that editorial process is then explained within the context of a clinical topic, rather than relegated to a footnote or a bibliography. Clinicians can access quick summaries or more depth appraisal of an article. The primary source is provided as a hyperlink if the physicians need quick access to the original article. The quality of the evidence in a study is also graded to provide the user the confidence they need to make key clinical decisions.
DynaMedex has so many useful integrated tools, more than any other clinical decision support tool on the market. Before DynaMedex, I carried multiple apps on my phone or references in my pockets, such as medical calculators. DynaMedex has EBM Calc medical calculators integrated within the product. Drug references. DynaMedex has Ask Watson, which is much faster than any other drug reference due to its natural language processing AI assistant. But it also has Neofax Pediatrics for pediatric and neonatal specific drug dosing, as well as a drug interaction and an IV compatibility search tool. Patient handouts, which are collected from a variety of national and international reputable sources and are written to be easy for patients to understand. Guidelines, including national and international guidelines available within pertinent topics. PubMed searching, the ability to do a literature search from within a DynaMed topic which is targeted to my specific needs, so I can access primary source literature with ease. It also includes a means to follow my topics of interest, so I keep current on the latest information in my specialty. The fact that I can get access to all this vital information and these tools critical to my practice and the care of my patients in one application represents immense value, and it saves me time. Finally, DynaMedex is a valuable communication tool for providers, not only among team members and between colleagues, but with patients as well. DynaMedex is useful to all members of a multidisciplinary healthcare team with information relevant to nurses, pharmacists, respiratory, physical, occupational, and speech therapists, nutrition team members, and physicians. Topic information, including videos, images, and algorithms, can be printed, followed, cited, or shared via email. Inpatient nurses and pharmacists utilize Ask Watson and the drug IV compatibility checker to ensure medications are given safely and adverse reactions are quickly identified. Therapists may utilize patient handouts from topics such as falls in the older adult to review ways to make the home environment safer before hospital discharge. I hope this brief review of the many advantages of DynaMedex as a tool for clinicians, including its efficiency, its currency, the rigor of evidence it presents, the presentation of evidence in context, its value, and its use as a communication tool, have helped you understand the value of DynaMedex. I appreciate your time.